Indian experts' findings have in fact suggested that the Delta variant is behind India's second wave of COVID-19. Now, this according to a government study that was conducted by the Genomic Consortium in India and the National Center for Disease Control. They believe that the Delta variant, which is now dominant in India, caused the second wave. This is a variant that is dominant in Delhi, Andhra Pradesh, Gujarat, Maharashtra, Odisha and Telangana. This Delta variant, or the B1617.2, which was first found in India, is 50% more transmissible than the Alpha variant, or the B1617, which was first found in the UK. There is an increased chance, experts say, of a breakthrough infection with the Delta variant. What does this mean? Breakthrough infection is if you can get infected with COVID despite having antibodies, which may be induced due to the vaccine, or you may develop them naturally after a COVID-19 infection. Now, this study was conducted on 29,000 samples that went through genome sequencing. 8,900 samples of COVID tested positive for the B1617 and over 1,000 for the B1617.2, which is a lineage of the B1617 that's being found in India. The study, however, says that at this moment they cannot link the severity of disease or increased mortality to the Delta variant just yet. Now, another interesting study that's been done by Lancet has suggested that people who are fully vaccinated with the PFIZER-BIONTECH vaccine are likely to have more than 5 times lower levels of neutralizing antibodies against the Delta variant, which is first found here in India, compared to the original strain. This according to the latest research that's been published by the Lancet. Now, the Lancet also says that the antibody response was even lower in people who received just 1 dose. The study also suggests that the best way to deal with this Delta variant is to deliver the second dose to people in a shorter span of time. This, of course, raises questions now on India's dosing regimen, remember, which is between 12 to 18 weeks, at least as far as Covishield is concerned. The Lancet study also supports the current plans in the UK to reduce the dosing gap between vaccines from 12 weeks to 8 weeks. So, some very interesting studies and very interesting revelations. What do these studies mean? What do these revelations mean as far as our fight against COVID-19 is concerned? We're joined by a panel of experts to help us make sense of this. We're joined first by Dr. Dhiman Kahali, Director of Interventional Cardiology, BM Birla Heart Research Institute from Kerala, from Kolkata, I beg your pardon. Thanks so much, Dr. Dhiman, for being with us.
Thank you. Nice
I want to begin by asking you about the Delta variant. Now, according to the Indian genomic study that has been done, and of course the NCDC is party to this study as well, the Delta variant is believed to be behind the second wave of COVID. It is also still the most dominant variant here in India. Now, this is worrying because the study also says that it is 50% more transmissible.
Yeah, you are true that in UK also, this is the variant which is gaining predominance in the second wave of SARS-CoV-2. And India too, this is Delta variant, which we are getting more from the genomic sequencing study, which you mentioned just now, with 29,000 odd patients. And it has been shown clearly that the transmissibility of the disease is much more with this Delta variant in comparison to the previous one, that is the Alpha one, that is 117.2 variety. So there is another variety, which is the South African variety, and the transmissibility is less with that one too. So the Delta variant is much more transmissible, and the bad news is that even the Pfizer vaccine is not acting against this Delta variety. Not only to tell, rather our Covishield is better in that way from Pfizer.
Doctor, I'll come to the Lancet study in just a bit. I'll come to the Lancet study in just a bit, and we will of course talk about the Pfizer versus the Covishield or even the Covaxin efficacy. But I want to just ask you about the other very worrying aspect of the government study, which says that there is an increased possibility of breakthrough infections. How worried should we be about this? Can you explain this to our viewers? Because as we understand it, breakthrough infections basically means that you can get COVID even if you have antibodies.
Yeah, so it is not totally dependent on the antibody titer. And it doesn't depend that how much is the antibody, total antibody, because there are different factors. And even in the presence of high titer of antibody, especially the elderly individuals can get the infection. So this is very worrying. And this Delta variety, we don't know much about it. Only good thing is that though the infection transmission rate is much more with this variety Delta 1, but the death rate is not that much with Delta. That is the only point which we want to mention. But it's not that people are not dying of Delta, but they are dying, but the death rate is not much more. But the transmissibility is much more, and a high antibody titer, one should not be complacent that he is not going to have the infection. So there are other factors too which are incremental in causing the infection and the death thereof.
Doctor, the first question that came to my mind when I read the details of this study was the fact that the study is silent on vaccine efficacy. The study talks about breakthrough infection but doesn't talk about vaccine efficacy against the Delta variant. Now, the Lancet paper suggests that Pfizer is 5 times less effective against the Delta variant. The Lancet paper also says that you should reduce the dosing gap for more efficacy against the Delta variant. Do you think that India needs to perhaps reconsider this 12 to 18 week gap that we have?
Yeah, absolutely. We have been talking about that because the evidence in the different literature do not show that 8 to 12 weeks duration in between two vaccines is rational. Rather, all the vaccines in US, the Pfizer has been given at 4 weeks interval. Moderna has been given at 4 weeks interval. If you see the Sputnik in Russia, it has been given at 3 weeks intervals. So all are telling that even the recent study in the Lancet have shown that the interval should be 4 weeks, in contradistinction to what our government has told that it should be 8 to 12 weeks. I am not a person, I am an interventional cardiologist. I don't want to comment on this, but from the evidence base, from the literature, because we practice on evidence base, from the evidence base, from the literature available, is very much pertinent and imminent that the gap should not be 8 to 12 weeks, rather it should be reduced to 4 weeks, what was the initial gap. And in the country, in Delhi, my friends, even the Director General took ex-DG, Dr. Taji, he took it at 6 weeks interval. But in Kolkata, we were taking it at 4 years intervals. And all the literature shows that the best action comes if we take it at a shorter interval, that is 4 weeks interval.
Right. So you think that, and there has been a lot of flip-flop as far as the dosing regimen for Covishield is concerned. It was 4 weeks. It was then increased to 6 to 8 weeks. Now it's 12 weeks. Do you believe that, we need to have a little more clarity, more consistency when it comes to the dosing regimen? Because it does create a lot of questions and doubts even in the mind of the people.
Yeah. I think there should be clear, direction from the government level that we should take it at a 4 weeks interval, because all the data shows, all my friends in US, doctor friends, specialist friends, cardiologists, they have taken at 4 weeks interval.
Right.
So the best efficacy comes at 4 weeks intervals, and it has been shown even in the elderly, the antibody formation is best, not to tell of in obese people. And it is irrespective of sex as well, that the antibody formation and the T-cell immunity comes best if we take the vaccination at 4 weeks interval.
One sincerely hopes that there is, a concerted, coordinated policy decision that is taken on the dosing regimen of Covishield, because, at different times we've had different experts tell us different things. At one point we were told that 12 weeks means that you'll have a 30% more enhanced efficacy. Now we're learning that with the Delta variant, the dosing gap actually needs to be reduced. So one sincerely hopes for some clarity from the decision makers. But thank you so much, Doctor, for sparing your time this Saturday morning and being with us on NDTV.
Thank you very much. Thank you.